Welcome to Let's Talk Health. I'm your Captain Marvel Ochieng, and almost everyone experiences some sort of trauma, but the symptoms vary from one person to another. People with PTSD experience extreme symptoms of trauma. So today we are going to talk about PTSD. What exactly is PTSD? I am here with Dr. Jen Waidera. She's going to help us break down and know more about PTSD. Welcome, Dr.
Thank you so much.
It's been long.
It's been a while.
It's been a minute.
Yeah.
So first things first, please tell us, what is PTSD?
Okay. Thank you so much, Marvel, for having me here a second time. I'm excited to be here today, maybe to just talk about PTSD. Those are just initials, and so I would want to make it full and clarify to us. PTSD stands for post-traumatic stress disorder.
Yeah.
And as the name suggests, it is post-traumatic. So it means that someone experiences trauma of some sort, whichever kind of trauma it is, and there is a lasting implication from the trauma. And that is what we call post-traumatic stress disorder, that once you experience the trauma, the symptoms are still recurrent even to a later date. Yeah, so that is what we call PTSD.
And what causes PTSD?
What causes PTSD? Clearly, it is trauma. Any kind of trauma. I will use an example of rape, an example of maybe even a road accident, something that might look simple. But once someone experiences something that is going to traumatize them, some people are not able to suppress the feelings. They're not able to suppress the fear. So they carry it further to even years. Yes.
So an example of, let's say someone grew up in a family where the parents were a bit violent, does it mean that it's going to be automatic they are going to have PTSD?
Okay, no, not really. You see, it becomes PTSD when it affects you over a length of time, over a period of time. If the symptoms probably are carried forth even to adulthood, then it means probably this person was not helped in between. No one intervened. And that is where we have psychologists, that is where we have counselors who come in to help you deal with the symptoms, to help you deal with the issues from the onset, so that you don't carry them forth to a later age. So it does not necessarily mean that in future you're going to have the same thing recurring to someone. But if you don't get intervention, there is a probability that the people we are seeing today maybe having domestic violence are people who suffered from the trauma before.
Now that you have mentioned their symptoms,
yes,
what are these symptoms that one should look out for?
Okay, PTSD has got several symptoms that would look like depression, would look like any other mental condition, because it is a mental disorder in its own sense. So some of the symptoms we see is withdrawal. You will find someone withdrawing from the public, or rather withdrawing from any circumstance or any situation that would look like the same as what they experienced before. Like you find, for instance, if someone was raped, they would avoid darkness all the time. And probably the darkness is not as bad as it was, but you would avoid the darkness because every time it's dark, it reminds you of that situation. Another thing that we find some people have intrusive thoughts. That is, you have defeating thoughts, you have thoughts of failure. Some people will have hallucinations, like for the children. You find for the children, they will not sleep at night. They are having hallucinations, others are having illusions. We have others who end up getting suicidal thoughts. You know, they're feeling like they don't want to live anymore. There's no reason for them to be alive. It depends with the magnitude of the trauma. Other symptoms to look out for is a loss of interest in activities that one previously enjoyed, you know. Maybe you enjoyed watching movies, you enjoyed talking to people, but now all of a sudden you just don't feel it no more. So those are some of the things you might look out for. Others will start indulging in substances like drugs, anything that will help them forget about what they went through, anything that will help them get out of reality. So those are the things to look out for.
Now that you have mentioned, one can get themselves into drugs,
yes,
have suicidal thoughts. How bad can this get?
It gets badder, but I will still emphasize on it depends with the kind of trauma someone went through. Most of these people who go through things like rape, they end up having suicidal thoughts and feeling worthless and feeling like they don't want to exist anymore. Because one, we understand how the depth of rape can be to a person. So with suicidal thoughts, we have experienced very many cases of people who have gone through trauma and they didn't deal with it, and they get to a point where they're feeling, no, there's no reason to live. So it really gets there. It gets there.
So what should one who's probably having PTSD do to when experiencing these bad moments?
Okay. Number one, we are not going to overlook the place of having a support system. A support system of people who know what you went through, and people who understand what you're facing, and they understand that this is a condition that you're undergoing through. And so these people are going to provide a safe space for you to exist, in that when you're feeling like you're getting low, they are there to help you get over it. There are people who understand that their circumstances, when you're exposed to, will always take you back to what you went through. So you'll not overlook the place of people who will help you in the society. The other thing I will say is that when the feelings are too much, you can always see a counselor, you can always see a psychologist for therapy. Therapy helps a lot. And on our end as psychologists, when we can't help you in as much, probably we'll offer you therapy and feel we are not there yet, we would link you up to a psychiatrist who will be able to bring in the medication. So we are going to couple medication and therapy. Because at times there are people who get to a point where now this graduates into depression, you know, and you wouldn't just tell them, come, we sit down and talk, yet already their health is affected. So we pull in psychologists, and we also say it's good to always take a breather, just go out, distract yourself from the activity, because there has to be a trigger. Every time the feelings are coming, there has to be something that triggered you. Probably you were watching a movie. Probably you were talking to someone and they give you a story and it reminded you. Distract yourself.
You can at least give us something, a little bit of the treatment process for people with PTSD. People
with PTSD, we have therapy sessions. That we cannot really approximately say how many we do, but normally at least in every 2 weeks we have a session. In every 2 weeks we have a session. We give you assignments, that is takeaway assignments. There's something we normally say, for you to deal with a phobia, you expose yourself to the phobia. We say systematic desensitization, little by little, exposing yourself to what you fear so that you see whether you will be able to deal with the feelings differently. Because if you're exposed today and then the feelings you're going to have today are not the same feelings you're going to have in a week's time or a month's time. So we normally have therapy with the affected. We have therapy with the significant others, the people around them, maybe parents, maybe a spouse if it is a grown-up, maybe your children if you're staying with your children. We do a training or we do some education to them on what you're going through and how to handle you. So we normally have that. And maybe now you're put on mood disorders, like for the psychiatrists they put something like fluoxetine and some other treatment therapy to help you get over it.
Help us break the stigma that comes with medication when it comes to PTSD, mental health in general. Do PTSD patients, are they given like medicine to take, and are they lifelong medicines?
For the PTSD, normally what we do, we give you medication that will help you relax. We talk about relaxatives, things that will maybe help you. Some people you find will come with symptoms of what do we call it, of insomnia. They're not able to sleep at night. So depending on the presenting symptoms that someone comes with, there's a different medication for that. And it mustn't be a long-term thing. It depends with how long the symptoms last. And there are symptoms that we don't really need the treatment. We only need therapy and exposure and, you know, just helping you through it. But it is not really a lifelong thing. But you see, I've said that PTSD can lead to depression. And once it leads to depression, we say depression cannot be treated. It can be managed. We manage depression. We don't really treat it. We just manage it. So even for the PTSD, depends with the degree at which it presents.
Okay.
Yeah.
So I'd really love you to stress on the support needed for people with post-traumatic stress disorder, because in most cases in the society you would find that probably I am a PTSD patient, but then my neighbor would feel like, oh, she only wants attention and everything, and so maybe you put some stress on what is needed to help people with PTSD.
You see, some of the problems we are having as adults today are as a result of experiences we had in our childhood or experiences that we've had growing up that were not dealt with because of the fear of exposing what we are going through or the fear of being stigmatized. Some of the people we see out here that are bitter, some of the marriages that are failing out here is as a result of someone that hurt, someone that was broken before, yet was not given an opportunity to express what they were feeling. PTSD is common, and probably all of us have got instances where we wouldn't want a repeat of something that we went through. And we think it's normal, but we need help. So I would emphasize to the society that this is something that is normal and everyone is going through it. The difference is how much it affected you. So it is not really right to critique, or rather to make someone feel uncomfortable because of a situation they went through or a fear of going through the same situation. Therefore, we find people putting a shield, or they're putting a defense mechanism sort of, so that they don't get exposed to the same thing they once went through. So it is normal and it is very okay for someone to face this, and please give them help. They need your help, they need your support. Yeah.
And probably the last question or something, do medical covers, do insurance cater for treatment for people with PTSDs? And
I'm a health personnel and I work in a facility, and all the insurances offer space for mental health treatment. You just come with your insurance, we just run the card, and we see you for as many sessions as one would require. Probably what we normally do is we can write them a report if need be. If they want a medical report, we give it to them, but we don't expose the details, because you see, this is a purely confidential circumstance. But yes, insurances do cover.
So your clarion call, even as we finish this, on people without insurance covers. Yeah.
People without insurances covers, you can always reach out on a psychologist. There are times we even give them pro bono services. We don't charge, depending on, you wouldn't really leave someone hurting and paining because they don't have money. No. Just reach out for help. Don't break down, don't die, don't commit suicide. Reach out. You can get my number, you can call me if need be. You get to that point where you feel you need someone to talk to and you really can't afford it, you can always reach out. And for them that can afford it, and probably they don't have medical covers, therapy is not expensive. Therapy is not expensive. Some of us charge 2,000 per session. And maybe on agreement basis, there's always you can always come up with a treatment plan that is affordable, but just reach out.
Nice. Thank you for coming.
Anytime.
We would love to learn more about PTSD, but I think you have given us the basics.
Yes.
On our next session, I will still have you.
Because
mental health is something that is affecting our generation mostly. Yeah, so thank you so much.
Anytime.
I have been here with Dr. Jen Waithera. She is a psychologist, and we've been talking about post-traumatic stress disorder, PTSD. It is something that is affecting us, mostly this generation. We are going through a lot, and mental issues are just, it has become too much. Go for help, seek for help. You have had it, they even do pro bonos. So till next time, I have been your captain, Marvel Ocheng. Bye.